were all crises, like wars, famines, pandemics. They mentioned, no one knows what's going to happen in the future, but there are some examples of things that have happened in the past that can kind of give us a better idea than others. And one of the case studies that the international or Lean In and both the International Rescue Committee are using is how this is what happened during the Ebola outbreak in West Africa in 2014 and 2015. So women and girls represented 2/3 of infections because they had increased exposure thanks to the caregiving roles that they played. So they were really the predominant ones caring for family members and patients too in the system. Women, by the way, there's all these other effects. Women were stigmatized for keeping an unclean home if a family member fell ill. And young women were less likely to go back to school after a break in their schooling due to the outbreak. So there's all kinds of effects. And when it comes down to women's health specifically, they found that in Sierra Leone alone, there were an estimated additional 3,600 maternal deaths, neonatal deaths, and stillbirths because there weren't enough medical resources to care for pregnant women during the outbreak.
So this kind of brings to mind, I think, two questions I have from when talking to them and just kind of your other research is one, I mean, you can compare this to other crises. I was wondering, is the coronavirus and its impact on women, is it pretty similar to kind of previous, kind of pandemics and different kind of crises? Kind of is my first question. And then two, like, what's their reaction been to their research? I mean, are they getting traction in some of these governments? Are people listening to them, or do they feel like they're kind of like waving the white flag and potentially, unfortunately, what their findings, may be true, but just nobody's kind of listening to it at this point?
Yeah, I think that coronavirus is playing out pretty similarly in terms of these other effects that they were seeing. Like they pointed to Ebola. They expected a lot of similar effects from what we saw in Ebola. But of course, the difference is Ebola was fairly localized and, hit a few countries very hard, poor countries. So not great, it's always worse for the more vulnerable populations. But COVID and coronavirus is worldwide. And so what we're seeing is really all these things happening on a much grander scale. And it happens differently in all kinds of countries. In the US, it's not really a worry whether women are going to go back to school after the outbreak ends. But in other countries, that's a really big worry. So I think part of what they were advocating for too is a gender-based lens on this, but also like an awareness of kind of the specific problems and needs in your country. I think, so it's the response in terms of the gender lens, I would say the two of them think that it's been totally inadequate. Like there hasn't been enough focus on these aspects that are really disproportionately hitting women. I think David pointed to one UN report that really mentioned that there was a big UN appeal for aid, for what countries can do to combat the coronavirus. And there was a small mention to domestic violence in it. He felt that there was really not nearly enough in there to show that countries are really paying attention. But I do know since then that certain UN groups have really focused on this and pushed this as a big priority. Of course, we've also seen a lot, like a sort of lack of UN cooperation when it comes to fighting the coronavirus. Like right now, countries are really going on it alone. So like Trump didn't call the G7. There's not a lot of international cooperation. So it's hard to say what kind of influence those international reports will have on individual leaders.
One of the big things that we've seen, certainly in the US, a lot of reporting on throughout this crisis is kind of this impact of women who are on the front lines, as you mentioned, kind of the nurses and others that are really being impacted in a way that I do think the stories are being highlighted maybe more than sometimes they typically are. But can you talk a little bit about that? And just kind of as you've covered this for the last several weeks, are there any kind of storylines that you're covering that you think we all should be paying attention to when it comes to women on the front lines?
Yeah, I was thinking about this. I mean, I was trying to think of an example or a similar crisis that has so disproportionately relied on women on the front lines. Like you think about World War II, where it was men really in battle, women were on the home front working in factories, keeping the economy going. In this case, women are keeping the economy going, but they're also on the front lines. Like they're the vast majority of nurses, the vast majority of home healthcare aides, a majority of essential employees, the people who are still working to keep us all fed as we stay home. It's pretty remarkable. I think hopefully in the newsletter over the next few weeks, I'm planning to feature some stories of women who are on the front lines, like whether it's someone who's checking out at a grocery store lucky to keep the job, but dealing with children at home from school, or whether it's someone caring for the elderly. The elderly have gotten extremely hard hit by this disease. You have to be really careful. These people they're not paid very much. They had lack of access to protective equipment. And then there's a lot of people who now are asked to take on caregiving roles who aren't necessarily used to it, which can be extremely difficult, mentally taxing, mentally trying. So there's a lot of stories out there. It's pretty remarkable historically. I hope it maybe changes the way society sees women and the role they play a little bit more.
Yeah, for me, I think it's so important just because often in Washington, we can get lost in these kind of $1 trillion packages and squabbles that often, kind of devolve into partisanship and kind of the rural urban divide. And so, we've been talking a little bit kind of behind the scenes about this idea of really featuring some of the women who are on the front lines, just because I think it's an important reminder for all of us that what the human toll is here and what's actually happening on the ground. Another thing we're going to be talking a lot more about over the next half hour or so is a theme that we've been seeing a little bit more talk about, which is really the mental toll. There's obviously the death toll right now. Over 60,000 people have died from coronavirus, which is just stunning. But there is this kind of issue that is becoming even more so, this kind of almost PTSD for some people that have been through this, kind of these kind of pandemics before, people that are stuck in their houses and they don't know how to respond, from the caregiver to the employee to the spouse. In some ways, it seems like there's a lot of light being shed on this through articles and studies, but it also doesn't seem like there's much of a resolution or way to solve for this. What are you hearing about in terms of just kind of mental health, the fact that, it seems to be hitting people pretty tough?
Yeah, I mean, I would say that it's clearly going to be very traumatic for some people. I think if you're looking at a silver lining, perhaps we could say that any kind of collective trauma that forces us to become more empathetic and have deeper windows into each other's personal lives can be a good thing, especially for women. So, we're humanizing the people we work with, and we're maybe living through some struggles that we've never lived through before, but that people struggling around us have been dealing with for a while. So I think empathy in society is a good thing for women. Women are the ones who have traditionally carried heavier burdens. They've had to juggle work with kids. They're traditionally paid less. They work a majority of minimum wage jobs. So maybe this can cause workplaces, husbands, friends, society as a whole to become a little bit more aware of how we treat women and what we expect from them. The other thing is, I mean, you see a lot about, I think when I look online and look at what people are talking about, the kind of PTSD, the trauma, the wellness stuff is right out in front. It doesn't seem like it's hidden. And I think one of the problems you deal with a society is if these kinds of things are unacknowledged or hidden in the background. I think the best thing we can do is talk about it right now.
Absolutely. Well, one of the things that we try to do in these conversations is bring our audience in. So I want to remind everybody who's listening in, if you have a question for our panelists, you can tweet Politico Live with the hashtag Rule With Us, and we will take questions. But I actually got a few questions by tweeting about this and all my kind of different platforms. And one of the big questions, Elizabeth, that I think we often get is people want a sneak peek a little bit behind the scenes. You write the weekly Women Rule newsletter, which is fantastic. If you don't receive it already, you can text Rule With Us to 66866 to get signed up for it. But the question was, walk us through a little bit about the newsletter and kind of how you put it together. What does that look like?
Sure. Okay. So broadly, the newsletter is about women in power. So we cover women, politics, policy, and we like to make it news driven. So if you read it, you'll see it usually begin with something original that feels in the news. So for example, maybe it's an interview, maybe it's a deep dive into an issue. This week, I'm going deep into whether women are really better leaders than men when it comes to tackling coronavirus. Talk to a couple experts. And then we really try to give you the news of the day through this gender and power lens. What's happening in the race for the vice president. How is coronavirus affecting women? What's the latest in Me Too that you need to know? And then there's a section that really gets into longer reads, some things that maybe aren't driving the day, but that are really interesting to know, new findings about women's health, like just a fun history piece about, the first woman, to orbit the earth, like things like that. It's pretty fun. And I think, you work with me on it and I do the top section. My colleague Maya curates the reads. I think you'll enjoy it if you take a look.
Yeah, no, I think what I always love about it is it comes out like Friday, just when you're, need a break from the work week, certainly from a Zoom conference call or whatever. But I always find a story that I may have missed or that brings something different to the conversation, which I really enjoy. So we are almost out of time. We are going to be joined here soon by Carolyn Witte. But first, I'm going to ask you a question. I'm asking everyone these days because it's partly my own sanity that I'm looking for, but what is one thing you're doing to keep sane during this stay-at-home period?
Well, okay, I'm definitely relying on walks, I'll say that. But one thing that I did was I rearranged my living room. It was great, actually. It kept me moving. It made me feel like I'd accomplished something, and it gave me sort of a fresh perspective. I'm sort of making it an ongoing project, so it's like things move every few days.
Well, hopefully you'll come back and join us. So we'll have to look at your background and see if something has moved or not. Elizabeth, thank you so much for your time. I really appreciate you joining us, and hopefully we'll see you soon. I'm going to bring in next Carolyn Witte. She is joining us to talk about women's health amid the coronavirus pandemic. For those of you who are watching, who are unfamiliar with her company, TIA. Carolyn, I'm hoping you can kind of give us a little bit of a download, what it is you do and what it is kind of the company does.
Sure. Thanks for having me here. So I'm the co-founder and CEO of TIA. We're a next-gen women's healthcare company building a new model of care end-to-end for women and providers online and offline. And what that really looks like is until 6 weeks ago, we were actually a brick and mortar only women's healthcare practice in New York City at the really epicenter of the epidemic, where we deliver gynecology, primary care, and wellness services to women in New York. And we build all sorts of technology for patients and providers designed to make healthcare more personalized, more convenient, reimagined really for the modern era. And as a healthcare provider in New York City, as a founder, as an employer, who employs both, all sorts of different types of people, including healthcare providers, but also responsible for thousands of female patient lives in New York, we really had to evolve our model in real time to serve the need of our patients. And that meant making some really hard decisions, like, do we close our doors and go 100% virtual? What about all the other healthcare needs that women have that don't have anything to do with coronavirus? How do we protect our patients? How do we protect our staff? And what is the role of an innovative healthcare provider to their own patients and the broader public health crisis. And so our response to this has been evolving a lot in real time, following in line with a few core principles. First and foremost, what do we need to do to keep our patients safe and provide that immediate care that they need around COVID testing. And as of today, we now actually offer our patients antibody testing, which is a big, exciting new step that we're taking in response to patient demand, as well as sort of changing in real time research around the importance of testing, both COVID testing and antibody testing, to help us understand who exactly is infected and how might our immunity individually and collectively help us better understand what going back to normal, if that's a thing, really looks like for women and our society. So that's a really exciting thing. We closed our physical doors and launched virtual care. So that means providing healthcare services via chat and via video to our patients, and really testing the bounds of what you can do online and offline. Obviously, not everything in women's healthcare, as Elizabeth described, can happen on the internet, which is something we continue, is really core to our model. But we really were challenged to think outside the box and saying, how do we deliver critical healthcare services, both with related to COVID and related to your broader healthcare needs, like birth control or UTIs or pelvic pain or all the things that happen every day. Your regular healthcare needs don't stop just because the public health crisis started. And so we're able to evolve a lot of our offering and deliver that type of services to video visits, through video visits.
So obviously, I mean, this is, it's very fast. I mean, you're kind of giving us an eye into a couple of things, right? The healthcare system and its impact the coronavirus is having, to a startup and kind of a company that is dealing with in real time, what you're going to do with employees and all kinds of things. And then, kind of this decision to really embrace the virtual, embrace the disruption and kind of having to adapt. It's pretty phenomenal. I want to ask you, kind of zooming out a little bit first, and just like from your lens, there's so much discussion right now about the pandemic and its impact on women's health. Mm-hmm. What trends are you seeing from kind of the questions you're getting, the patients that you are seeing? What are there any one or two or three things that you've noticed a real change in?
Yeah, it's really reinforced, I would say, a lot of our core hypotheses we had about how women's healthcare is so broken before COVID. I think it's in not just women's healthcare, our healthcare system, this crisis, as they do, reveal broken systems, right? That's what they do. And they make them very vividly clear so no one can look past them. And I think it's on entrepreneurs, on politicians, on all of us to use those as opportunities to rebuild better systems, not just put Band-Aid solutions on the crisis. And that's really what we've been aiming to do at TIA. And so a few of those core insights that, again, I had spidey sense or saw some breadcrumbs before the crisis, but became very clear. The first is the reality that most women, most young women, don't actually have a quote unquote doctor who's theirs and a relationship with the healthcare system at all. So 1 in 5 millennial women don't have insurance. Very few women have a primary care doctor that they call this is my doctor, or an OBGYN. And that was one of our insights in really fusing primary care and gynecology into an integrated model and saying, can we build a medical home for women? Can we be that relationship, that front door? So healthcare becomes as simple as, I'm a woman, I have a need, I turn to Tia, who takes care of the rest, not I'm a woman, I'm having anxiety, which doctor in which specialty and which insurance company do I turn to? Or I'm a woman, I have postpartum depression and now I need to go somewhere else, and all of those things, and make healthcare less complicated. So that became very clear with seeing women turn to Tia, technically a gynecologist, for all of their COVID related issues, saying, I don't know where to turn to, but here's this company called Tia that I trust, that I can interact with on my phone, that's giving me latest evidence-based information as things are changing in real time, and can I just turn there? And so us on the other side, we've had to evolve our needs to better serve that wider range of needs that women are turning to TIA for. So that's one core insight. And I think the need to have for women and men to have a relationship with the healthcare system, not just when something is wrong, but before something goes wrong, is really important to drive, real preventive healthcare outcomes, which is the most important thing we could do to prevent crises or curb the fatality rate of these types of crises in the future. So that's one insight. The second is the very intricate connection of women's mental health with their core physical health, which again was also something we saw before COVID, but became exacerbated. About 20% of our patients have a history of sexual trauma. More than 20% are diagnosed with anxiety or depression, and diagnosed again by their gynecologist at TIA. In response to COVID, we saw a 400% increase in messages related to mental health and requests for mental health related medications, Xanax, antidepressants, those sorts of things, with nowhere to turn to get support, whether medication is needed or therapy or other types of mental health care services, and really speaks to a true mental health epidemic we're also experiencing before COVID, but has become very clear that as being exacerbated. And just tying into a few things Elizabeth talked about that I think were really interesting is, why is this happening? Women, why do we see this in the data? We know that women are diagnosed with anxiety and depression at twice the rate of men. There are a lot of complex reasons, some having to do with psychosocial factors, some having to do with physiological factors, hormones, all these other things that, lots of different perspectives on why that is. But I think in terms of times of crisis where the bulk of the burden tends to fall on women, whether as care providers, as mothers who are working mothers. I see it in my own employees trying to hold their jobs and also, deal with having kids at home who aren't in school. It's stressful. And a lot of these issues are exacerbated. And so women need more support systems. And the support systems they did have very much crumbled during this crisis. And we see that in not just the mental health needs, but we know again that the impact of that is on your physical health too, and why it's so core to offer mental health integrated into a clinical delivery model, which is something we were able to roll out at TIA and provide mental health services for our patients in response to the crisis.
So you're learning so much in real time, and everybody's kind of being impacted together at this point as we're, in the middle of sheltering in place and reopening is happening in different states at different times. Are you starting to plan for kind of longer term changes that you just think are going to, there's going to be a longer tail to this, whether that is people who just have become more comfortable with telehealth or with being on an app, and how do you kind of see, is there any foreshadowing of what you think 6 months from now, 2 years from now could look like for a company like TIA or for a woman trying to get healthcare?
Yeah, I think this is the founder entrepreneur question bet, right? And trying to make bets on the world with imperfect information. And so the way really we've looked at this and is looking at the data, what are we seeing? How is consumer psychology changing? How is regulation changing? Really boring things, but important things like billing for virtual care that impact access. These are things that are really real that have to do with why people didn't use these tools in the past, while also looking at saying, how do we think, what needs, what does the future look like, and what is the best type of care to deliver to women in after this crisis. And we continue to believe that virtual care is a tool in the toolkit that we should use that can increase access and make for healthcare across the continuum, but is not is not a silver bullet. Not everything can be done on the internet. You can't deliver a baby on the internet. You can't get a pelvic exam on the internet. And real world connection is very, very important for obvious reasons, like I mentioned, but, I would say, this notion of a relationship with your provider, which is something we invest so much in at TIA. So my bet on the world, where it's going, is that more will be done on the internet than we ever thought before, but we will also, both in healthcare and beyond, place a higher value on human real world connection. And the real opportunity, I think, for anyone, whether you're an entrepreneur or on the politics side or thinking about systems change deliveries, thinking online and offline and integration. And I say the future of women's health is vertically integrated, not vertical, or virtually integrated, excuse me, not virtual only. And that's really about figuring out how do we deliver healthcare to the right person at the right time in the right place, and make it more convenient, more connected, more personalized for the needs of specific populations like women, versus one size fits all. And that to me is the biggest shift we're going to see in medicine.
Well, thank you so much for that. I want to remind our audience that if you have questions for Carolyn or for Senator Tammy Duckworth, who's coming up in a few minutes to have a conversation with us about this and many other things, you can tweet Ask Politico Live with the hashtag Rule With Us, and we will try to get to some. I have a few in the queue right now, Caroline, so I'm going to turn it over to some audience questions. And the first one I thought was pretty interesting. It says, based on data, what questions or trends, if any, have made female patients more susceptible to getting COVID-19?
It's interesting. I don't know the answer. I don't know what data there is out there about to inform that women have in fact been more susceptible to getting it. We know that, as was mentioned, women are not actually are not being infected at as the same rates of men, and definitely not men are dying at higher rates than women are from this disease. And the reason for that, if I can invert the question a little bit, is really about chronic disease and comorbidity, or one of the related reasons for that. And if you look at who is getting infected and ultimately who is really getting really sick and not recovering, it's people, men and women, with chronic illnesses, and that speaks again to the need for preventive healthcare services, even amidst a crisis, and not just a healthcare system that treats sickness or the acute care.
All right, we have one more question. We're going to quickly kind of be running out of time here, but the question from the audience is, what can be done to, this is probably more in your kind of expertise, what more can be done to make telehealth as accurate as possible? Are there best practices that should be employed, or kind of lessons that you've learned?
Yeah, so telehealth is a really big category of stuff that can include everything from filling out a form to talking on the phone to getting on a Zoom call. And different tools can be useful depending on what the issue is at hand. I think video is which we're constantly pushing the limit of, is a really powerful tool to simulate in real life connections, some of the more EQ things you pick up in a visit. I hear from our care team all the time that they actually get different signals from patients video chatting with them in their home context than they might at the doctor's office, where you're in this other foreign land, so to speak, and they let their guard down. Maybe they're more willing to talk, I think. And that's been a really surprising thing for our care team to learn from. I think the biggest frontier, one of the big frontiers, is how what happens in that video visit is connected afterwards. Whether that's through remote patient monitoring of devices, blood pressure monitoring, scales, urine analysis tests, all sorts of things like that, diagnostic tests, and then ultimately how that data is then shared back with that primary care provider, OBGYN in our case of record. What is a really big problem is when you have this one-off virtual visit that's completely siloed from that patient's comprehensive care. And you can see this happen a lot in pregnancy, where a lot of problems arise and that virtual care provider doesn't have that patient's health history. So I think the most important thing is really context and data connectivity, ensuring that patient and the provider are connecting the dots to that patient's comprehensive history.
Well, thank you, Carolyn. Our time here is quickly coming to an end, with Senator Tammy Duckworth about to join us. But before we let you go, I'm going to ask you the question I asked Elizabeth earlier today, and I'm asking everyone. Can you tell us one thing you are doing to stay sane in these times?
For me, I'm a big writer and journaler, was before the crisis. That's a big thing for me. Start my days every morning before I get on Zoom or make coffee, and journal. And it helps me separate my days. I found myself struggling to separate the days like a lot of people, and setting a purpose and documenting this crazy time that we're living in has been one thing that's keeping me going.
All right. Well, thank you so much for joining us. I appreciate it. I'm going to turn now to Senator Tammy Duckworth, Democrat from Illinois. Thank you so much for joining us. I saw there, I think you had a child there.
Yeah. Oh no, I'm just talking about you, honey.
The juggling of motherhood
So
never
sorry.
ends. We've got a
And
lot.
that was Abigail, my 5-year-old.
She's very cute. We got.
I was born on the year of the horse.
Oh, she said she's born on the Chinese year of the horse.
Oh, wow. I love it. Fun fact.
It's a very good luck year.
We got a
sit down,
ton to
baby.
get to in a short amount of time, but I wanted to ask in the beginning is just, I mean, kind of this question, right? Which is, how are you personally juggling motherhood, obviously full-time and a half job as a senator, and everything in between during the pandemic?
Well, I think like all the other moms out there, working moms out there, it is a handful. But listen, I am doing as best as I can, just like everyone else. And I'm less worried about me because I still have my job. I'm still getting my salary. I have my mom who lives with us, who helps. So yeah, it's tough. I mean, I'm sitting at my kitchen table where 3/4 of it is filled with homeschooling books. I homeschool Abigail every morning. And then I switch to, my constituent services mode for the rest of the day. But I worry about, the mom who's a nurse, who's a single mom, and she has to go into work because she's essential, and yet her child is at home and she can't be there to homeschool her child. And she's worried, is my kid falling behind in school? So I'm more focused on the working families out there that don't have it, as the kind of support that I have.
Senator Mitch McConnell he's calling the Senate back into session next week. Some of your colleagues, like Senator Dianne Feinstein, have questioned whether it's actually safe to return. The House has decided to put it off for a little bit longer. Are you concerned about your and your staff's safety next week?
I am very concerned about people's safety next week. All the folks who, I live with a 2-year-old and a 5-year-old and a 79-year-old mom. So my house is full of folks who are vulnerable, in the vulnerable category to this pandemic. I worry about all of the workers who have to ride the public transportation system to get into work. It's not just about the senators coming in. When we come in, it means all the janitors have to come into work. It means that more doors are open in the Capitol. So that means more Capitol Police have to man more positions. And there's a whole logistics system that comes in with it. My colleagues and I are well taken care of. We have an attending physician. Now he's advised against this, as has the Surgeon General. But we're well looked after, and we have health insurance, not like so many other Americans. I worry more about the folks who, are going to have to be supporting us and what's going to happen to them.
I want to bring in an audience question that has been on my mind a lot, and we've been talking with other reporters about this, which is, the question is, how can we better address racial and ethnic disparities in women's health that have really been exposed by COVID-19?
Well, this is a really complicated problem because it predates the pandemic. Last year, I started the Environmental Justice Caucus, and I was very proud when I asked Cory Booker to join me in starting it, that he joined me as a co-chair. Black and brown communities in particular are the poorer communities. They're the communities where we have traditionally located our most polluting industries. So for example, the south side of Chicago, the west side of Chicago has some of the most polluting industries. And in fact, we have the highest rates of asthma, for example, among children in African-American communities. That makes them more vulnerable when a health crisis like a pandemic hits. But these communities already have reduced access, not just to a clean environment, but reduced access to healthcare, preventative care, all of these things, so that when a pandemic hits, you're seeing the rates of people becoming positive and suffering from them that are far higher among minority communities. I'll give you an example. African Americans are 15% of the population in Illinois, yet they're 36% of the people who have become victims to the COVID-19 virus. And this is pretty consistent across all of our minority groups. And so we need to just make sure that when we emerge out of this, I'm certainly going to make sure that we invest more money into things like more testing in minority communities, making sure that we have better healthcare access. And, we need basic things in this country like, standard paid family leave. If you are a janitor and you rely on that paycheck and you come down sick, you're still going to go into work. If testing isn't free and it costs $50, you're not going to get yourself tested, so you're not going to know, and you may end up far sicker when you show up at the emergency room. We have a broken healthcare system, and we have a broken system in terms of supporting of our working families, and we can and should do better.
I want to take a little bit of a step back, and obviously the Trump administration has been leading on this, the response. How would you grade the Trump administration's response so far?
A failure. I would grade it a failure. I mean, the president knew about this pandemic in January. We now have documentation that shows that he was told how serious it was going to be. He was briefed on it, he was advised on it. And instead of taking action, for example, to ramp up testing or make sure that we logistically centralize our system for distributing PPE, he was spending time talking to people about how the Chinese have the whole thing under control. And he was basically pandering to President Xi of China. And then said that was boasting that we're not going to have any cases by the time we get to April of this year. Well, we see that is wrong, and so we can do better. I've been pushing him to do better with the Defense Production Act, to centralize distribution of test kits, of PPE, and all the materials that we need to make this equipment, so that we can get help out to all of our communities, not just the big cities, not just the White House, not just the Senate chambers, but to all of our communities, whether they're in rural communities or underserved populations.
You're part of the president's kind of task force that he called up most members of the Senate to be a part of. Has any action been taken there?
No action that I know of. We have had just one meeting, and that was a telephone meeting, about an hour long, 45 minutes of which the president spent boasting about how well he was doing and how we had conducted more tests in the United States than any other country, and that in fact other nations were reaching out to him to ask us to send them more test kits. It's all a bunch of baloney, to put it, because my daughter is in the other room, to put it mildly. We know that those are not the truth. We know that we need probably 2 or 3 more times the number of test kits than the president claims we need. In fact, his own team, Dr. Fauci, said the same thing. He said we would need upwards of 5 or 6 million tests, not the 1 or 2 million that the president has put out at different times. They don't even have the basic math down right as to how many test kits they need, how much testing needs to be done. So I would hope that the committee would meet again, and that we would, as a task force, come up with a real concrete step-by-step way to move forward, which can't start without testing.
I think one of the biggest anxieties right now that a lot of families are facing is the question of school, right? When are kids going to go back to school? Is it going to be safe? How can you expect a 5-year-old to understand what social distancing is? School at that age is learning how to share a toy. How concerned are you about the safety that people are going to feel confident that their kids can go back to school?
Well, I'm terrified about my daughter going back to school and being out of my sight, to make sure that she's constantly keeping herself clean and sanitizing and all of that. I think every mom and dad feels exactly the same way. So that's why I think we need to make sure that we have all the protocols in place, that there's enough hand sanitizers, that there's enough test kits. So, I'll give you an example. In Israel, they test all of their frontline medical personnel every 3 days. Like if you work in the hospital, you get tested every 3 days. If I knew that my daughter's school had all the testing kits and that they were free so that they could afford it to test everybody from the janitors to the cafeteria workers to the teachers, I would feel better about her going back to school. But if you're going to say that, she's just going to go back into school, and there are no protocols, and we have no way to do contact tracing, we have no way to do widespread testing, I would think seriously about sending her back to school.
2020 election is quickly approaching. You are one of the women who is frequently named as a potential vice presidential pick for Joe Biden. Have you talked to him or his campaign at all?
Well, I've spoken with the vice president just because I've worked with him over the years. Both he and Dr. Biden actually have been such wonderful supporters of military families. And I think one of the things that I like about Vice President Biden the most is just his empathy and his ability to understand where people are coming from. And he certainly understands that as a military family member himself. So yes, I've talked with him in those terms. But I've really been focused right now on COVID-19 and serving my constituency in Illinois.
But have you given them any documents, or are you going through the vetting process?
I have not given them any documents. Listen, we are very fortunate in the Democratic Party to have a lot of very well qualified women in the Senate. I'm just proud to have my name mentioned in the same breath as the likes of Kamala Harris or Amy Klobuchar. But again, I'm just focusing all my energy right now on getting my state and my country through this pandemic and making sure that we take care of our working families out there.
Well, before I let you go, one of the biggest issues at the presidential level right now is the sexual assault allegations by Tara Reade against Joe Biden. Do you think he needs to respond more directly to them? And does it give you any pause in supporting him in November?
Well, let me just start off by saying that any woman who brings, or any man isn't that matter, who brings forward allegations of abuse, especially in the workplace, deserve to be listened to. And I certainly think that we need to thoroughly look at these allegations. It's why I supported, a real investigation into Dr. Ford's allegation against Brett Kavanaugh. And I think that there are ongoing investigations right now. I know that there are quite a few numbers of news outlets that are doing investigative journalism, and I certainly support that moving forward. And I think that the Biden campaign should, address this issue, and they have been.
Mm-hmm. But you still support him, obviously, as the nominee for in November for Democrats?
I do support him. Let me just tell you, I certainly would rather have Joe Biden in the White House than Donald Trump, a man who we have on record videotaped boasting about how he's assaulted women. I think that the way we move forward is to make sure that we allow the allegations to come forward and that we take a look at them. But let's not fool ourselves to think that Donald Trump is the guy that is going to most look out for women. Not when Joe Biden is the person who actually worked actively to pass the Violence Against Women Act and has been there time and again for military women in particular.
Well, Senator, before I let you go, the last question I'm asking everyone these days, I'm going to ask you, what is the one thing you are doing to stay sane during this crazy time?
I am trying to exercise and watch my diet. So I joined Weight Watchers, Wow. One of the great things about being home actually is that I'm controlling my food. When I am doing my job normally, every lunch is a meeting someplace and I don't get to control my food. So now that I'm home, I'm actually trying to be more conscious about cooking my meals for my family and myself. And I actually enjoy cooking. So I'm taking charge of a healthier lifestyle for my family is really how I'm trying to deal with it. I'm not always successful. There's been a few nights of pizza delivery or takeout. Actually, my husband goes and picks it up to support our local business. Yeah. But I have very boring chicken breast for dinner tonight. So
well, you're a better woman than I appreciate that on the dieting factor. Yeah. Thank you, Senator, so much. I really appreciate your time this afternoon, and thank all of you for joining us, who joined us on the live stream and watching us on all the different platforms. I want to thank Elizabeth Ralph, Carolyn Witte, and obviously Senator Duckworth for tuning in. We'll be back in a few weeks with another virtual briefing, this one on women and criminal justice reform. If you don't already get the Women Rule newsletter, you can subscribe by texting RULE with us to 66866. Thanks so much.